And we welcome discussion. So y'all feel free to go ahead and use those. Wonderful. All right, we are going to go ahead and get started. Thank you all so much for being here. We are absolutely excited to share with you this discussion on outcomes and evaluation and using logic models and theories of change, not only in program design, but also in our coalition work as we're supporting hidden helpers, or the children and youth and young adults who are impacted by the care needs of a service member. A couple of quick housekeeping pieces. We are going to use the Q&A and the chat feature today. We very much welcome discussion, so please use those at your leisure to send things to the panelists, and we will cover those components at the end of the presentation. And thank you all again for being here. And without further ado, I'm going to hand it over to my friend Amanda with Wounded Warrior Project.
Thank you, Hannah. Hi, everyone, and good afternoon. It's such a pleasure to be with you all today. My name is Amanda Peterson. I'm the manager of grant compliance with Wounded Warrior Project's Community Partnerships and Investment team. I want to thank Woodruff Foundation for leading this exciting conversation, providing their perspective as a funder, and Elizabeth Dole Foundation for hosting. I'm so thrilled for today's discussion, not only because of my personal passion for research and data, but because it is a core driver of everything we do at Wounded Warrior Project. Rigorous evaluation directly powers innovation. We owe it to those we serve to evolve and enhance our programming, our reach, and accessibility. Impact measurement helps us to recognize the progress we're making while reminding us how much further we have to go. And we know that no one organization can meet the needs of the 3 million post 9/11 veterans and their families alone. So it's only together through collective efforts like the Hidden Helpers Coalition that we can make the greatest impact. Wounded Warrior Project is proud to co-chair the Hidden Helpers Coalition alongside our friends at Elizabeth Dole Foundation. In the past year, Wounded Warrior Project has granted more than 1.4 million to power programs and services dedicated to our nation's youngest military caregivers. As part of that dedicated fund, Wounded Warrior Project is supporting the Military Family Advisory Network in leading this critical effort in collaboration with coalition members to build a roadmap toward a standardized program evaluation framework. This work is vital to the longevity, accountability, and effectiveness of the coalition. And the Hidden Helpers Coalition provides a unique opportunity for military and veteran-connected organizations to work together toward a common goal and utilize members like Woodruff Foundation and MFAN to enhance and advance program evaluation. So thank you once again for joining us today. I look forward to the conversation. And now I'm going to turn it over to Emily with Woodruff Foundation.
Thank you, Amanda. My name is Emily Krause. I am a senior program officer at the Woodruff Foundation, and I'm really excited to be here this afternoon. I'll start with a quick introduction to BWF for anyone who may not be familiar. We find, fund, shape, and accelerate equitable solutions that help impacted veterans, service members, and their families and caregivers thrive. And we view this work through 3 overarching strategic goals, which are to improve the health and well-being of veterans and their families, to strengthen communities' capacity to serve this population, and to inform and improve the veteran space overall through collaboration and thought leadership. I'm here today wearing a couple of hats. First and foremost, I'm speaking from our position as a funder in the space, and specifically as an outcome-oriented funder. We use the tool and framework of logic models in our evaluation of programs, and we believe that sound program logic is essential to making impactful investments. But I'm also here as a member of the Hidden Helpers Coalition's Impact Evaluation Subcommittee, which is why I will also be drawing on the expertise of Kate Clavijo from the Military Family Advisory Network, who will dig deeper into the importance of impact measurement how to implement an evaluation process that meets the needs of your organization, and how assessing individual program impact is going to feed into the broader goals of the coalition. Finally, we're here because the Mathematica report on hidden helpers highlighted some really compelling needs. And we know that in order to successfully meet those needs, both as individual organizations and as a coalition, it's imperative that we effectively measure outcomes and evaluate program efficacy. And that's true whether you are recruiting hidden helpers to an existing program, refining that program to serve them, or implementing new programming altogether. So we'll get started. Next slide, please. This is just a brief overview of what we'll be covering today. Next slide, please. I'm going to take us first to where we started as a coalition. For those of you who have read the report on hidden helpers, you may recognize this graphic. The research report on hidden helpers, or kids in caregiving families, has highlighted some key areas of need for this population, including access to peer support, mental health care, and age-appropriate developmental opportunities. At BWF, as a grant-making organization, when we see emerging research such as this report, we see a clear needs statement about a particular subset of the population that we serve. And our next question is, what are the evidence-based interventions that can address this need? Another thing the Mathematica report called our attention to is the relative lack of data on evidence-based programs and best practices for serving this specific population. But the good news is that through effective outcome measurement and program evaluation, we can begin to build that evidence base together. Next slide, please. I'm going to do a pretty high-level overview of logic models today. And the reason I'll be using the framework of logic models is because this is the lens that BWF uses when we evaluate programs. But whether your program or your organization already has a logic model, or whether you use a different tool or vocabulary to describe your work, the core idea I want to cover today is how to think strategically about program implementation and how to effectively evaluate your impact, and finally, how that relates back to responding to emerging research. Next slide, please. These are the components of a logic model. It is a visual tool that assists in program planning, implementation, management, evaluation, and reporting. Overall, a logic model is describing what is happening in the program in a linear fashion. It gives you a way to evaluate and improve upon your program, and it holds you accountable not only to your funders and stakeholders by demonstrating the impact you are having with your resources, but it also holds you accountable to the population that you serve, because a functioning logic model and evaluation practice will help you to refine and tailor your program activities and outputs to ensure that participants are achieving the best possible benefits from your program. Now, in a moment, I'm going to walk through these components in more detail, but I want to start by giving an example of what an effective logic model can help your program to do. So a partner of ours, like many other organizations, pivoted to virtual program delivery during the pandemic because they had a strong logic model and an M&E practice in place and historical data on their in-person outcomes. What they were able to do was compare the outcomes for their participants in virtual delivery versus in person. And where they saw discrepancies, they were able to step in, make real-time adjustments to their program delivery to help close that gap in what their participants were achieving. That's just one example of how a logic model is, one, an active tool and a process, but also can help your program to really adapt and improve. Next slide, please. The first two components of the logic model, again, bring us back to where we started at the Hidden Helpers Coalition. We came together around a specific target population, children in caregiving families, and the specific needs and challenges that they face. I want to underscore here that there should be data pointing to the need for your program. And also, as we move forward through the subsequent components of a logic model, that they should also tie back to this need. Next slide, please. Resources are the investments or the inputs for your program. We've listed some examples here: time, funding, staff, space, materials, partnerships. Activities are where we start to shift into describing what is happening in the program. These are the actions and efforts that make up the program and that are used to reach the program's stated goals. These include the services and tools that are provided to the target audience, as well as communication such as publishing and publicizing information. Program activities should have an evidence base for meeting the need you address. So a good example for this would be that if your program's goal is to improve the mental health of veterans with PTSD, a primary program activity should be providing evidence-based therapies for PTSD. Next slide, please. Outputs, intended outcomes, and measurement and evaluation. This is where things really get meaty and exciting. Outputs are countable. Now we're describing not only what is happening, but we're quantifying it. They are the amount, quality, or volume of goods or services that your program provides. So for example, this could be the number of training sessions that you provide, or the number of participants who complete your program, the number of workshops conducted, etc. Outputs are really process measures for what your resources are creating. And then your outcomes are measures on the individual level. They're the changes in your participants that are expected as a result of engaging in the program activities. It is important here to be thoughtful about attributing causality and to remember that individual participants are often being served by multiple programs that may be impacting them in different ways. Outcomes represent change over time, and they can be both short-term and long-term. They can be measured from start to finish of the program and even beyond program completion. And finally, outcomes should be SMART. That is specific, measurable, attainable, relevant to the need, and timely. When is the change expected? The final and really critical component is measurement and evaluation. Measuring program outcomes answers questions about how participants' knowledge, skills, attitudes, or behaviors have changed as a result of their participation. So if an outcome describes what you expect to happen, the measurement and evaluation describes how you know that that has happened. It's important to keep in mind that testimonials alone do not quantify program impact. They are valuable for supplementing your quantitative measures and putting a face on what your program is achieving. Measurements should be conducted through either validated scales or intentional survey tools that are designed to capture your directly attributable outcomes and that really relate back to the need that you're working to address. And finally, beyond considering the tools and measures that your program should use, it's also important to consider whether the response you're getting is sufficiently representative of the population you're serving. So I'm talking about survey reach and response here. And a good benchmark to use is that if you have a survey tool and it is reaching at least 75% of your participants and at least 75% are completing it, it's doing a great job of representing your population, and therefore you have pretty reliable program results. If it's reaching about half of your participants or more, and 3/4 are completing it, it's doing an okay job of representing your population, but you'll want to work on increasing the reach of your survey tool. And then finally, if it's reaching less than half or less than 75% are completing it, it's not very representative, and it's not going to give you the information you need to make sure you're achieving your intended outcomes. So to recap again, because that was a lot of numbers, in survey response and in evaluation, you want to aim for at least 75% reach and 75% completion. Finally, to sum up again, outputs and outcomes are both really important tools for demonstrating what your program is achieving with the resources at hand. And when it comes to building the evidence base for what programs are really effective in meeting the needs of hidden helpers, we really need those measured outcomes to know that we're producing the changes that we want to see. Thank you all, and I'm going to pass it over to Kate Clavijo from the Military Family Advisory Network to go into more depth.
Thank you, Emily. I am delighted to be here, and I'd like to provide some examples from the Hidden Helper Coalition to bring some of Emily's content to life. Next slide, please. So as Emily mentioned, outputs are the measurable, tangible, and direct results of program activities. Outputs are important because they help us understand how we are doing and if a program is being implemented according to plan. Some outputs are very obvious and easy to count and readily available. And other outputs are important, but not initially as obvious, but they do reflect the existence of something new. Next slide. So in relation to the Hidden Helpers Coalition, I want to point out the importance and value of considering some less obvious outputs. For example, here are some of the outputs for the Hidden Helper Coalition. Number of coalition meetings, numbers of organizations represented in the coalition, number of participants, the number of existing programs for Hidden Helpers, and the numbers of programs in development for Hidden Helpers. And some outputs that are not as tangible or easy to count, but can be just as important to measure include, in relation to capacity building as a coalition, the number of new connections or networks or new partnerships formed. We are striving to bring clarity to some common goals. And so an output is the number of goal-setting conversations. Emily mentioned an importance of identifying promising practices. And so one of our outputs is the number of effective strategies for supporting Hidden Helpers. Capturing this information for some may require a little bit more work, but they are valuable components to consider. At the end of the year, the Hidden Helpers Impact Subcommittee will be measuring collective outputs using a survey. This information will help us understand what the wide-ranging programs are, who is being served, and if the coalition efforts are being implemented and carried out as planned. Next slide, please. So I'm going to go through this slide really quickly. Emily addressed this very well. In contrast to outputs, outcomes are the measurable changes in the target population. We see these changes in attitudes, behaviors, knowledge, skills. And I want to re-emphasize that outcomes are changes, and changes take time and are usually incrementally achieved over time. So when we go back to considering the value of a logic modeling process, we want to consider both short-term outcomes, and often those are foundational to long-term outcomes or changes we want to see. Next slide, please. So I'd like to provide an example that comes from the Hidden Helpers Coalition Peer Mentor Subcommittee. This Peer Mentor Subcommittee is developing a toolkit to increase awareness of peer support best practices and core competencies. The toolkit is designed to help people understand the value of peer mentor interventions. A short-term outcome is that the coalition members access and utilize the peer support programming toolkit. Another short-term outcome is to increase coalition members' understanding and knowledge of peer mentor best practices. Then a medium-term outcome is that the coalition members and others working in this space feel motivated to use and share this resource. And then the longer-term outcome relates to the impact of the toolkit on the youth hidden helpers. So just producing the toolkit is one thing, that's the output, but disseminating it effectively and ensuring it is utilized effectively is another. Once members and professionals working with hidden helpers begin to see the value of a peer mentor model and refer youth to existing peer mentor programs, only then would we expect to see and be able to measure the longer term outcomes. And those have been defined by the Peer Mentor Committee as hidden helpers increase engagement with peer communities, building trusting relationships and social connectedness with youth from similar caregiving backgrounds. Next slide, please. So here's another example of a logic model. And this is, I present this example to sort of reinforce the value of creating a program roadmap, whether it is a theory of change or a logic model. This is a logic model that is being delivered by one of the Hidden Helper Coalition member organizations. And I'd like to acknowledge Melissa Como, who is joining us on this webinar today, for providing this excellent example. The Military and Veteran Caregiving Network is a program of the American Red Cross. It helps caregivers of all eras and at all stages of caregiving by providing access to tailored peer support programs. This slide captures just a screenshot of the complete model, but it is a graphic summary that clearly outlines the outputs that are expected to occur after the intervention is delivered. When you look carefully at the graphic, in terms of the boxes, you see a series of if-then relationships that connect the components of the logic model. So if resources, actually back a slide, sorry. So if the resources are available to the program, then the program activities can be implemented. And if those activities are implemented successfully, then certain outputs and outcomes can be expected. I want to mention the value of having this graphic or map for evaluators. It clearly outlines and streamlines the evaluation design process. It illustrates clearly what changes are intended to occur. And for funders, this illustrates clearly what activities will be carried out and what resources are used and the hoped for changes. If for any reason a program is not having its intended impact, the hope is that the team will revisit the logic model and consider if perhaps there aren't enough resources available, if perhaps the dosage of the program wasn't adequate, or maybe some of the outcomes are a little overambitious and need to be fine-tuned. Also, something to mention is sometimes there are outcomes that aren't laid out or intended or come as a surprise. And this process is intended to be dynamic and changing. And so we would always hope that there's an opportunity to revisit and add new outcomes as the program evolves. Okay, next slide, please. So articulating good outcomes is at the core of the evaluation process. When planning, developing, or implementing a program, knowing what to accomplish and what you want to accomplish is critical. Logic modeling is a process, as Emily said, and defining these outputs and outcomes can serve as a reflective or introspective platform for informing decision-making. When teams come together to discuss and clarify outcomes, it is a process of careful thinking and reflection about what is logical and realistic to expect. Clarifying the outcomes and being explicit can help provide the focal point you need to see if your program is reaching its target. Emily mentioned this. I just want to also reiterate, be careful of focusing too much on short-term, maybe perhaps satisfaction outcomes or measures of reaction. It's very common to have a feedback survey, but simply knowing people's reactions to a program or a training or even a coalition doesn't necessarily tell us what knowledge or behaviors have changed because of involvement in that program. And also I just want to say that quotes can be very powerful and illuminate themes that may come from your data, but these sometimes can be anecdotal, and anecdotal insights are based on individuals and individual experiences. And really what we're looking for in evaluation is strong evidence that is collected using a repeatable method and can be independently verified. So anecdotes on their own are really not evaluation. Next slide, please. I'd like to make two additional points about evaluation and measuring outcomes. First, evaluation is all about building evidence. When it comes to measuring outcomes, data provide the evidence we need to help us answer our evaluation questions. Data can be numbers, but it can also be systematically collected observations or stories. There are many types of evidence that help us measure change and draw conclusions. Second, a solid evaluation does not prescribe a specific research design. A good design answers specific questions, is tailored to the nature of the program, and is reasonable based on what expertise is available. Okay, next slide, please. So I've mentioned two terms when we talk about program mapping. And we've heard us say logic modeling and theory of change. Sometimes people use these terms interchangeably, and some might argue that a logic model is a theory of change. The Hidden Helpers Coalition has adopted the theory of change approach. This theory of change starts with having a clear focus on the goals and then outlines the strategies needed to achieve these goals. A logic model usually starts with what changes will occur with available resources and interventions. So sometimes the way I simplify it is if you're looking at the graphic or the map, a logic model, you might think of it as starting sort of from the resources, what's over on the left, and building it out towards the right, where a theory of change, if you look at the graphic, starts really by looking at the goals, and maybe you could even argue, taking a look at the graphic, working from the left to the right. The Hidden Helper Impact Subcommittee is currently working with each Hidden Helper subcommittee to create a theory of change. In this process, it's really the discussions that help bring clarity to the strategies that will lead to our common overarching coalition goals. The Hidden Helper Coalition work is grounded in an understanding that child well-being happens in and across multiple systems of the individual family unit and community. Hidden Helpers' well-being is also influenced by government policies and cultural norms. Because the Hidden Helper Coalition is made up of so many diverse organizations working with distinct target populations who have their own organizational goals and priorities, having this overarching theory of change helps reinforce a commitment to a common agenda and common goals. So whether it's a theory of change or a logic model, the goal is to be detailed and clear about the shared vision and bring and build an understanding of how small changes and individual programming can support efforts to achieve broad goals. Okay, next slide, please. Okay, one of the recommendations that came from the Mathematica report was to identify, research, and scale programs or promising practices that are likely to improve outcomes for children, caregivers, in military caregiving families. So as a result, the Hidden Helper Coalition is vested and focused on collectively developing quality programs and interventions to help hidden helpers. So taking a step back, a point to consider in this approach to identifying quality programs or promising practices is the stage of a program's development. It's common for people working towards ambitious goals and striving to make a difference to want to measure changes in the target population. However, programs and initiatives can only be effective and lead to promising practices if they're implemented effectively. Therefore, so during the early development of a program, the focus should really be on how to design the program and to ensure that it is relevant and as sound as possible. Usually in the early stages of a program development, we would encourage formative evaluation or process evaluation. And that really does, going back to the logic model, that's where we look more at the outputs and short-term outcomes. And later, once a program is worked out, a summative or impact evaluation is more appropriate. So conducting a summative or impact evaluation too early in the development of a program can often lead to inconclusive results. In conclusion, evaluation is a process. I hope that the examples and insights I've shared have helped illustrate how the process and collaboration that's needed for thinking through defining outcomes and outputs and either building a logic model or a theory of change can be beneficial. MFAN and the Hidden Helper Coalition Impact Subcommittee are leveraging these tools to collaborate with the coalition in a structured way. It's helping bring clarity to our common goals and a better understanding of our collective impact. As a network of organizations and institutions, we want to help ensure hidden helpers are recognized, heard, valued, and have access to supports and resources to optimize their well-being. And with that, I'm going to hand it back to Emily.
Thank you, Kate. We can take it to the next slide, I believe. and we'll take it right on to the next one. So I want to double down on a few things that have been discussed today, and then we'll transition to time for some questions and discussion. Again, logic models provide that clear picture or roadmap of what your program does and the changes that you hope to achieve. Again, to refer back to Kate's points about the distinctions between a logic model and a theory of change. Logic models, for today's purposes, we're looking at what is happening at the individual program or organization level and documenting the changes that are happening to individual participants. And theories of change for the coalition are also looking at why, starting from the overarching goals and needs that we have around creating a space that better serves the needs of hidden helpers. And we're doing this work at a coalition and systematic level. So there's sort of a snowball effect here that the individual program changes, those individual program logics are building evidence and building individual outcomes that are going to contribute towards these larger goals. And that's why it's important for us to really talk about both. Logic modeling is collaborative. It is, again, a process, not a product. A logic model is not something that you create and then file away and check off your list. It's really a tool to continually engage in strategic thinking about program implementation and improvement. It can be adjusted to best fit the stage and needs of your program. And ultimately, our real goal in sharing this content today and sparking this conversation among members of the Hidden Helpers Coalition is to get us all involved in helping to build evidence for what really works to serve the kids and caregiving families. So thank you all again, and I think we have some questions that have come in.
Yes, we do. Thank you both for your presentations. We've got a couple of questions that I'd love to take some time to answer. It looks like they are for both of you. So we'll start with, could you both speak to your thoughts on balancing validated measures and satisfaction or open-ended type data? And how do you decide what types of open-ended questions to include or prioritize?
Emily, you want me to take a stab at that?
Do you want to get started? Yeah.
Well, my initial response, and I hope this is helpful, is, and our webinar is limited in the detail that we've gone through. We really focused on logic models, but what I would encourage you to do is, the reason we put so much emphasis on having clarity around outcomes is the approach you use to measuring the change is really dependent on the outcome. So rather than focus too heavily on this is going to be a closed-ended survey item or an open-ended, look at the outcome and consider and this is when Emily said reasonable, meaningful, thoughtful, this is exactly what we mean, is look at the outcome and as a team, consider what's the best approach to measuring that before instantly assuming I need to have a validated survey tool or this has to be a pre-post survey. I hope that helps, but in the process of logic modeling, when you really look at the outcome, the appropriate method will become more apparent.
I agree, and I would say when it comes to the validated measure, or again, I want to emphasize an intentional survey tool, because it may not be appropriate, as Kate said, to use, for example, a specific clinical scale for a program that isn't relevant for. So when it comes to the survey tool, I would approach it again by starting from the outcomes, that intended change, and just thinking through what needs to be asked and assessed in order for me to understand whether that change has happened. And then for the more qualitative or feedback-based questions, I think that's also highly specific to the program. It's about what else you feel you need to know from your participants.
Fabulous. Thank you, ladies, for that context. Our next question is, we know that survey fatigue is a challenge. Are there other tools we might consider to get to our evaluation goals?
I find it interesting how often people say I do evaluation, and someone says, I like surveys, or I don't like surveys. I think there are so many, and I hope this message came across, there's so many ways to collect evidence and data. A lot of sources of data are already existing. That's one thing to consider. Look at what information you already have available. I would say, absolutely, depending on what you're trying to measure, what change you're trying to measure, focus groups and even observations can be really valuable. But again, bringing it back, it really depends on what you're trying to measure. If anything, I'd actually encourage people to maybe step away and just be thoughtful. I think we too often jump straight to the survey and consider carefully what information is already available. Put yourself in the shoes of the participant. What would you feel motivated to respond to and provide meaningful data? I hope that helps.
Sure, and piggybacking on that with a couple of things, I think technology can really help here in terms of streamlining processes for your participants, and boosting responsiveness. But again, as Kate said, be sort of thoughtful about the motivation of your participants to complete something. So that can mean, if your survey has 55 questions, take another look. Can we simplify? Can we really drill down to the most important things to make sure that we're encouraging participation? And also, can you describe the purpose of it in a way that helps to increase buy-in, and really sort of communicate that the survey is more than just, homework at the end of the program, that it sort of has ongoing value.
Yeah, Emily, thanks for hitting that on the head too with homework, especially as we're talking about and focusing on kids here. That can definitely be a deterrent when you're doing survey with kids and personal experience of like, oh, this is just like school now that I'm having to do this. Love that. And before we get to our next question, the Q&A, starting from the front end of that, Emily, you talked about having a backing of data when developing new programs. So for someone who is just starting to build a program, where are some of the places you would recommend they go to gather data that either confirms there is a need or demonstrates that maybe there are already things doing that as they have that whole development process?
That is a great and very deep question. As far as where to turn for information, it does depend on the services, and on the organization. I think, one great example is if an organization has a specific geographic focus, there are a lot of reports and briefs that come out from state and local government with a lot of information on community well-being and resources and social determinants of health. If you're looking to build partnerships to, for example, serve hidden helpers, to build partnerships with educators, look at some of what's being published in the education space, maybe outside of just on the military veteran population. I would say there's no one answer, but think about some of those defining characteristics of your target population and then think about who else is serving them or might have insights that can help you identify what they may need. And then also look at, organizations that are conducting population-focused surveys. The Military Family Advisory Network is doing this in this space. Blue Star Families, Wounded Warrior Project, IABA. There are many more examples that I'm going to miss, but really leverage partnerships to get at as much data as you can. And also listen to the voice of the people that you're looking to serve.
Awesome. Kate, do you have anything to add to that before I move on to our next question?
Yeah.
Fabulous. All right, so the next one in our Q&A, what are some challenges you all have experienced in implementing an effective logic model or theory of change?
That's a great question. Emily, do you want to go first?
Sure. I'll give a brief answer, which is it can be challenging to distinguish outputs from outcomes. And particularly to take the next step of thinking through not only what is happening, but what changes it is causing. And I think, that's a place where we really dig in our evaluation of programs. And I think that continually tracing back to that initial need is one of the most helpful ways to get sort of over that threshold and start thinking about not only what services need to be provided, but why they need to be provided.
Yeah, and I would say, I think just the title, logic model and theory of change, can sound very sophisticated or complex, when in reality it's the most simple thing in the world. It's putting down what you do on paper. It's more complex than that, but it begins with a simple process. And so I think that one of the challenges I've seen is when people get too hung up on either specific wording and or even design. I would encourage everyone to just start off with a rough, messy draft. And it really is the conversation and the discussion that's the value. And don't worry so much about having a polished document at the end. That it really, in my opinion, the benefit is the deeper thinking that happens after that first draft. And then when you go back and visit it, and then when you go back and look at your logic model as your program's being implemented, does this make sense? Is it logical? Are we having these changes, and why or why not? So I think that's probably a barrier, is people might see an example logic model online or a theory of change, and they want theirs to look like that. And in reality, it's meaningful when it's tailored and specific for you and your organization and the work you're doing.
Thank you, Kate. I'd like to dig into that a little bit more, but for our attendees, I want to throw it out there that this is your last opportunity, going once, going twice sold, to put your questions in the chat or the Q&A. Kate, you talked a little bit about working on the theories of change for the Hidden Helpers Coalition. And we know as program design people too, it can be challenging balancing the different opinions of what our outcomes should and could be. So can you talk a little bit about your approach to distilling the thoughts around outcomes and what our programs are doing to develop that cohesive approach to our logic model or our theory of change?
So and I didn't go into this in too much detail, but I will say for the Hidden Helpers Coalition, we actually started with a logic model process. And in some ways, I find that what we do know are the resources available to us. So that that component of the logic model when we first got started was it gave us an easy starting place. We put down, what we know we have available, what activities we know the coalition is going to be working on. And then when it comes to defining the outcomes, quite honestly, this is what we did, is we put a very rough draft together and pulled a lot of the outcomes from language that came from the Hidden Helper Coalition Wellbeing Framework, came from the Mathematica report, and then we circulated it with people. So we circulated it with our impact subcommittee, we circulated it, and we hope to continue to circulate it. And people commented and said, I think you've left off this important change that our coalition work will accomplish. So we add that, and someone else might say, I don't really think that outcome is relevant to our work. And so we take it off, so it really is iterative, it's dynamic. And I think it's almost like it's a process you have to go through to see the value in. It is the shared discussions that lead to a more refined logic model or theory of change.
Thank you, Kate. Emily, do you have anything to add to that question?
No, I think that was great.
Wonderful. We have one more question in the chat. And can you speak to how often you should revisit your logic model and goals for the program so that you can make changes in a timely manner?
That's such a great question. I think in the midst of all this, if I may, I think what we want is we want buy-in, we want enthusiasm for doing evaluation. We want to see the value in this for helping our target population. And so I would say that the response to that question is really dependent on an organization, their capacity, their interest. It may be that there is a sort of a champion for the logic model who, ends up revisiting it quite often and makes changes. And it may be that it's built into your organization as something more formal. Like, I'm just going to throw out, and this totally depends on the program, but maybe it's, and the pace of how it's being rolled out, but maybe it's every 6 months, Sorry, there's no defined answer, but what I would say, instead of giving a direct answer, I would say, I would want the outcome to be a high level of buy-in for the process. And that's more important than defining a specific timeline for revisiting it.
I agree. I think, you can also take into account the program model. For example, if it's operating on a cohort model, you have, set times that you expect to get new outcome data in that you can start looking at and comparing to previous data. I would also add that reevaluating your logic model and some of the conversations that would come up around this can also contribute to kind of other evaluative processes that your organization may go through. If you're pulling together impact reports, annual reports, we all go through a lot of processes of kind of documenting our progress and our impact. And a lot of that will speak back to the effectiveness of your program and your logic model. So it could also be a thought of how do we fold some of this, as Kate said, deep thinking or strategic thinking into processes that we already have in place.
Well, I think that's a beautiful way to kind of surmise all of this. Yes, there are times when there's really distinct process and things that need to happen, but so much of a logic model and the program development piece of it is dependent on your own situation and your own organization and the population you're serving. And it's important to remember that sometimes, especially when we want I'm a person who really likes structure, and to know that, yes, in 6 months, I'm going to revisit this, but sometimes that just doesn't work for us. So thank you both for your time today. Thank you to your organizations for sparing your expertise, for your time in presenting and preparing this presentation. Thank you to our friends at Wounded Warrior Project for being here as well, and to our background team supporting on the other side of the webinar. And thank you to all of you for attending and taking this opportunity. We will send out the recording and slides that are available after the recording processes, and reach out to us and let us know if y'all have any follow-up questions. And thank you so much, and have a lovely rest of your day.
Thank you
Thank you.
for coming.